Hi, and welcome to Chamber Chats. I'm Bruce Williams, the CEO of the Greater Victoria Chamber of Commerce, and this is our regular series of conversations with business and community leaders about what's going on as we maneuver our way through this pandemic. I would like to begin, as always, by acknowledging that I live and work in the ancestral territories of the Lekwungen-speaking Coast Salish nations, those being the Esquimalt and the Songhees. We are proud and pleased to be working with them on a regular basis. This program is being shot in the studios of Czech Television in the podcasting studio, and this broadcast is presented by our presenting sponsors, Island Savings, a division of First West Credit Union, and C-SPAN Victoria Shipyards. As we moved through the pandemic, through different news sources, we started to hear stories about long-term care facilities and what was going on within those walls. A couple of guests right now to tell us all about that, who are CEOs of a couple of organizations that deal in that very sector. First of all, Amir Hemani is the CEO of the Berwick Retirement Communities. Amir, hi.
Hello. Hi. How are you? Thanks
Good.
for having us.
Thanks for being here. Dave Cheperdak is the president and CEO of the Broadmead Care. We're going to call you the Broadmead Care Society. David, is that the full name?
Sure. Yes, it is.
Okay.
We're known as Broadmead Care. Care.
So Broadmead Care, David, huge organization. You have how many employees?
Probably about 750 now, I think.
Yeah. So let's just get a little snapshot of who is Broadmead Care.
So Broadmead Care is a nonprofit society, and we operate 5 care homes now. We started with 1. We now have 5 in the South Island, ranging from all the way from James Bay to Sydney. And also in all of our care homes, we now operate adult day programs. So where we support seniors who are still living at home, but are able to come into our care homes for various types of support so they can stay living at home longer. And as you said a moment, we have about 700 amazing staff, and they're really our heart and soul. Bruce, 85% of our budget is people.
Yeah.
And so we're all about our people, and we're so very proud of our staff, particularly with the work we've been doing through COVID during the last year.
Yeah, that's going to be the crux of our conversation today. Amir, Berwick Retirement Communities are across the island and elsewhere in BC too. Tell me about your model.
Yeah, so we are a family-run organization. Chris and Gordon Denford are our principals. We operate independent, assisted, and long-term care. A few of them are campuses. We operate from Victoria to Campbell River. We have 7 communities. Our newest community is in the ground as we speak in Parksville, and our one off the island is in Kamloops, Berwick on the Park. Our organization is about 700 employees as well, mostly doing hospitality-based services for our residents. And as David said, they are the heart and soul of what makes our operations tick successfully.
So once this all began about a year ago, Dave, let's start with you. What you suddenly realized, okay, we're in a pandemic, we have people to take care of. What sort of action did you have to take right away?
The first thing, Bruce, we had to do was respond to the province's request through the provincial health officer to move to what was called a single site mode of operation. It was called the single site transition framework. And I would say Broadmead Care was probably one of the first organizations in the province to complete that process. We completed that within about 24 hours and moved. It was very difficult to do. Because the way we operate, we share staff across sites. That's how we operate efficiently, particularly since all of our locations are reasonably closely located. And so we had to move to that single site model. So Bruce, that was the very first thing we did. And then of course, very shortly after that, moved to a model where we were screening staff for every shift for COVID symptoms and taking their temperature, that kind of thing. And so those were there were many other things we did, but those were the first couple of things that we had to do immediately.
Right. So Amir, I think it's a little different with you because you're across a number of communities. So your staff really isn't really going from property to property as much. But tell me about your early steps at Berwick when the pandemic was declared.
So much like David, prior to the single site order being enacted for us, as information was evolving and growing around COVID-19, we were still learning what is this all about. And I got to tell you, it started to feel a little bit more daunting and heavy as the information in February continued to evolve. And so I remember there was a day with our COO where the first case had come onto Vancouver Island, and it may have been a knee-jerk reaction for me, but I said to her, I said, Kelly, shut the dining rooms down. No more residents in our private dining rooms. I feel like if we're going to get one, we're going to get 21 in the blink of our eyes. So That was probably our first most significant change, was to confine our residents a little bit more to their suites, and to start doing in-room service rather than the normal hospitality model that we would have offered.
So that I would think would have been a little bit disruptive to residents, but when you explain it to them that it's for their own safety, they become compliant, I'm sure.
Yeah, absolutely. I mean, I would say we didn't get a lot of pushback from our residents. They knew that these were measures that were being taken for their safety. They were taken for our staff's safety. So there was a lot of support, including from the families as well. Very much so.
Okay, so Dave Cheperdak, let's jump a couple of months ahead after those initial times. What sort of measures had to sort of evolve as you were working through this with your staff and residents?
Yeah, there were many other steps that were taken. A big one, and Amir's would have done this throughout all of his sites as well, was a significant enhanced infection prevention control protocols were put in place. So even though we already had very high standards in long-term care, we really needed to enhance those in many ways to as a key step. So that was another step. A big step, and of course a very difficult one for families, was when we had to begin screening for screening visitors. And then when the province implemented new policies around just one designated social visitor into long-term care, and then what's called essential visits as well for near end of life and that kind of thing. So that was a very complex change to implement, and a difficult one, because of course our relationships are most important to us, and particularly in late life. So that would be a whole conversation there alone, Bruce. But those were some big changes that we're still working with, and just trying to maximize opportunities for families to stay connected with their loved ones. I mean, we do thousands of visits a month, but they all have to be scheduled now, right, according to the orders. So it's a massive undertaking for staff. And again, they're doing an amazing job to keep those connections and people connected together.
Well,
And of course, technology played a big part of that as well.
oh yeah, yeah.
Yeah.
We're all suddenly
Yeah.
we're all technical experts. We can do all this stuff on a regular basis. I want to talk next about the life inside the walls of long-term care facilities. It's the next topic I want to get to here. So, Amir, with the Broadmead properties, in many media circumstances, we saw repeated pictures of family members visiting family members through the windows of their rooms and through facilities. So, I want to talk a little bit about the life inside the facilities during the, I guess, for lack of a better term, the lockdowns that were happening. People may have had the impression that life was tough and that it was lonely and that it was austere inside the facilities, but Amir, that wasn't the case, was it?
No, at Berwick Communities, our staff, I mean, the optimal word here these days is pivot, but our staff really just changed the way they approached resident engagement. And knowing that these were going to be lengthy and challenging absences from family members who were not going to be able to visit, we had to up our game. We had to up our creativity, and we had to find different ways to ensure that those that may have had some cognitive deficits and just couldn't understand, why is my family not coming to visit anymore, really had to bridge that gap, which was very hard to do, and really try to provide a bit of comfort against the fact that the familiarity of what they were used to seeing was no longer coming through, the front doors for them. So upping the game of resident engagement was big. And then there's this whole thing of, why is everybody wearing masks and shields and gowns all of a sudden? And that's not a normal thing for us. So, there was a lot of stimulus that was changing for them. And so it was about keeping them engaged, but also trying to find the most balanced way to keep them informed as to sort of why we're acting in this way.
And Dave Cheperdak at the Broadmead properties, the care facilities that you manage. Tell me about that time when people were trying to cope with the fact that day-to-day life was different. So how was the morale and the spirit in the facilities with the residents?
That's a great question. I could just build on what Amir was sharing, which again, very much a similar approach. At Broadmead Care, we talk about the Broadmead way, and we've been working this for a number of years, and it's focused very strongly on a person-centered, relationship-based approach to supporting people in late life. So we just kept building on that when COVID came along. And even though we can never replace family time, we did have to help to fill that gap more by emphasizing with our staff to not be task oriented in their work, but relationship oriented and focusing on the person. And our staff do that in a beautiful way. And at the same time, doing all we can through technology and through the designated visitors to support, obviously, the direct family connection as well.
So Broadmead and Berwick are two among many, many long-term care facilities in this region, across the province, across the country. Dave, I'm going to stick with you for this one. So all of these reports start coming in, all of these outbreaks in various facilities in different communities across Canada, across North America, across the world. So what starts to go through your mind and your management team and your leadership team when you see all these outbreaks happening everywhere else? What does that that must have a visceral reaction to you and your team?
Oh, yeah, Bruce. I can tell you the first reaction from our team was one of compassion for those homes. I was, Lynn Valley, when Lynn Valley occurred in Vancouver. Seriously, our whole team, our heart just went out to them, because long-term care at the best of times is very challenging work, very rewarding, but it's challenging work. And just to know what they were going through. So I think compassion is the first thing that we deeply felt. Also, the concern about the messaging around that. I think long-term care homes were really given a very hard time back east, with some of those some of the media coverage. And I can tell you, Bruce, when we have staffing problems, long-term care, things unravel very quickly, just the nature of the work. So that was certainly a thought that we had as well. The other, though, for us was preparation. We need to be prepared here for when and if an outbreak ever were to occur. And that certainly, we worked even harder on it.
Amir, the same thing with you. What sort of things started to go through your mind and your team leaders and staff when you're starting to hear about these outbreaks in other communities around the world, really, when you stop and think about it? But what does that do to day? What does that do to morale and planning?
It's along the lines of what David said, a ton of empathy for the long-term care communities that went from one case to a proliferation of cases in a blink of an eye. The biggest challenge that we were seeing is, when you get an outbreak, staff are very scared. They may decide they don't want to come to work because they don't want to take it home. Yet there is still the resident support and care that still needs to happen. So there's so many conflicting stressors that you go through to try to make sure that you can continue to deliver what the residents need. But when it became a virtual nightly permanent fixture on the news, the long-term care, those three words strung together just became so negative. And I guess what I felt is it's not fair to have this one lens of indictment that all long-term care is exactly what we were, say, seeing happening back east. There's a confluence of a lot of factors that affected those issues, right? You have some old bed stock that has got quad beds for people to, and while that has to be in some cases, they contributed to the growth of those cases. So, but that is not the case all across the country. But by and large, I would agree that long-term care as bricks and mortar, they're more on the older side, and there's need for infrastructure improvements and support. But yeah, it's not a one-size-fits-all condemnation of it, because there are a lot of communities that were doing amazing. They were still thriving. They were doing well inside. And it was unfair to see them go down with the single paintbrush that takes everybody with them.
Yeah, I mean, granted, not all organizations or operations are 5-star the way that Berwick and Broadmead are. But David, it did show some cracks in the foundation of long-term care in some areas, didn't it? And as Amir said, it comes down to the properties, right?
Yeah, Amir's made such an important point. We're very fortunate in BC that, I guess it started with the Liberal government back in early 2000s when that 5,000 bed promise was made. And that was the beginning of a rebuild and a significant investment and recapitalization in long-term care. And that most long-term care in BC, not all, but most, is single resident rooms. which is a big step in helping to prevent the spread of COVID in the care home. So I think we're fortunate to have that. And what's interesting, Bruce, is the for-profit sector did a lot of that rebuild. So you can see the benefit, of having a sector mixed with nonprofit and for-profit providers. And I think BC's done that, pretty well. We've had a few bad actors. They've been in the media, but overall, it's a sector that's worked well together that way.
So that working together and that listening, of course, has created some things which I want to talk about next, and that is what measures are going to be permanent with long-term care. We're talking today with Amir Hemani, who is with Berwick Retirement Communities, and David Cheperdak from Broadmead Care. So, Amir, what's going to be permanent of the things that we'll have to use the word pivot. You've changed, you've morphed, you've gone forward. What will be permanent among the changes you've made?
So with all failures, I guess, come gifts of failure. And in those gifts of failure, we certainly have learned what things should stick around. We hope we don't have a version of another global pandemic, but telehealth was just big for us. It was huge. It was an opportunity to find a way for our residents to still get the medical supports they needed, the clinical supports. So we see a big growth at our communities to actually reverse engineer into existing spaces, dedicated telehealth spaces. So that would be one of them. Non-technology based, I think an interesting one here is how we approach sick leave. Sick leave is a very important concept now. And I think more and more of our staff are understanding that, it's not okay to come to work when you're ill, but that can only happen when there's support in behind it. So whether it's ownership based, whether it is federal government based, looking at a proper established sick leave program, I'm hoping that sticks around. I'm hoping that that doesn't disappear on us. And I would say to you that the ability to engage with stricter confines, I think, are things that we will always be doing now with our residents and embracing technology to make that happen.
David, anything you want to add to that about the Broadmead model?
Yeah, it's very hard to know, Bruce. Of course, what in the longer term, what measures will be asked to keep in place. There will be some, I'm sure. But I think the most important component, just to add to what Amir was saying, the most important component is the need for our staff who live every day, day in and day out with our residents in care, is that person-centered, relationship-based approach that is so needed in long-term care. It's very easy for this kind of an experience of COVID to actually push us back to an institutional approach in long-term care. We've been worried about that in the sector, and we want to absolutely resist that and use this as an opportunity to really learn just how important that approach to care is, and to support people, as we say, to experience well-being and happiness in late life.
There's a lot of people, I think, depending on their demographic, who have perhaps never experienced a long-term care facility. They've never been in one. They see them, they drive past them, but they've had no occasion to have a family member in there. My mother spent the last years of her life in a long-term care facility. And one of the things that I learned from that was, as both of you have intimated, the importance of staff, the role that staff plays, their compassion, their skill, their talents, their intuition even, and the attention they pay to that. What does the workforce look like going forward? David, I'm going to stick with you for that. We're going to need more workers, are we not? Sooner than later.
Bruce, staffing is a significant challenge in long-term care. There are just simply not enough people to go around, and we are surviving now in the sector with enormous amounts of overtime to make it work, and it is a big problem. And it's interesting. I had a conversation with my team today. We're considering the possibility in the future of actually running our own healthcare assistant training program. We just can't get enough from the colleges, so we hire everybody we can. It's just not enough. So I think we're going to have to really step out of the box, if you will, and look at ways, because we need caring people who are inclined to really want to love other people and care for them in a very special way. and it's just there's just not enough in the labor pool right now. So that's a big issue for us going forward. But I just want to say that our staff have been so amazing. Bruce, we gave you a word shirt from our organization.
Right.
Our staff,
Yep.
They picked a word. We asked them, pick a word that you're proud of for how our teams worked together during COVID. And so we put them all on a shirt. We had a word shirt week last week. And I think, our staff have really shown what it takes to be the kind of people that can continue to transform people's lives, even in the middle of a pandemic.
The workforce thing I don't think is exclusive to the island, Amir, and you've got a property on the mainland, but you're up and down Vancouver Island in Nanaimo and Campbell River and Comox, as well as Victoria. Was the workforce issue the same everywhere?
Yeah, absolutely.
Yeah.
Staffing was the bane of our existence. And at the very, you asked the question earlier, what did you do when this happened? Well, one of the first things we did is we realized we were going to have to go into an overstaffing model. We were going to have to overstaff only to get the staff we hope that we would be able to make, our operations work with. The biggest thing that I've learned with respect to staff, apologies, should have silenced that. The biggest thing that I learned that I probably didn't have the greatest lens on, that I promise I won't make this mistake again, and that is understanding the mental health of our staff, and understanding that pandemic or no pandemic, they've got challenges that exist outside of the 9-to-5 job, and they bring those burdens with them no matter how hard they try. We've got to find a collaborative way to help our staff build their resiliency, understand that, there are going to be some challenging days, and find strategies to work with them and to be even more compassionate to the last 12 months that they've been through. They're beat up and they are exhausted, Bruce. So really, I think better staff resiliency training, and more efforts and compassion really against mental health for sure.
Gentlemen, thank you both. This has been a terrific and valuable snapshot of what goes on in the world of long-term care, and we very much appreciate not only what you do to keep your employees and your staff moving, but to provide that sort of confidence for your residents and the families of those residents who wouldn't be, as confident in the health of their family if you were not doing what you're doing every single day along with your staff. Amir Hemani is the CEO of the Berwick Retirement Communities, and David Cheperdak is the president and CEO of Broadmead Care. Gentlemen, thank you both. Rest up. Stay safe.
Thanks, Bruce.
See you again.
Thanks for having us.
Thanks a lot, Bruce.
I want to say thank you again to our presenting sponsors, Island Savings, a division of First West Credit Union, and C-SPAN Victoria Shipyards. And thank you for watching Chamber Chats. We'll see you for the next one.